Dr. Zeeshan, you just asked me about the exercise, and maybe you could have added smoking and
Smoking,
alcohol.
yeah, 100%, 100%.
At least smoking. At least smoking, yeah.
Smoking, yeah.
Because for pneumothorax, obviously, the patient can, if it's primary, the patient can be smoker. So after that, if we move on towards the next part, so ideas and concerns were asked, and then he did the examination. So you told about the examination findings, and then after that, the management, it was fine. The management was okay, and if I would have time, I would have asked something in the management part, like, okay, how many days am I going to rest? Am I going to take rest from the work? Obviously, psychosocial was missed, so maybe the occupation could have been asked, because it was 2 weeks rest time. So obviously a person cannot stay at home. So maybe some sick note or something could have been given if the occupation was asked. And other than that, it was okay.
Yeah, it was a very good consultation. Yeah, go ahead, Dr. Zeeshan.
Yeah. I want to add a few things on in musculoskeletal pain, costochondritis. Depending if it's affecting life, 100%, we go for if it's a GP setting, we can offer, we can give sick note. But usually, we can tell that you can take attendance letter, okay? But for the long period of leaves, we don't usually recommend until if it's not affecting the life and the patient is, because it's just costochondritis which just goes away. And usually we don't recommend. We just, in the A&E, if it's in the A&E setting, we just say that you can get attendance letter. And where that you mentioned that you came to A&E. And regarding the sick note, depending upon the situation, that how pain is severe or not, then you would consider anyway. Yeah, if there is no life.
As the person, she was doing some sports and other stuff, so maybe you could have involved that
Yes.
for 2 weeks, 1 to 2 weeks, maybe, if it isn't relieved. So how about you avoid going for any kind of contact sport?
Let me show you a leaflet, NHS leaflet, all of you, for the costochondritis. So for the costochondritis, what leaflet which we give to the patient is very quite straightforward. So lot of things and advice, that is the best source. So let me share my screen. So it's quite very common whenever you are giving this leaflet, it will tell the patient what to do and what not to do in the next few days. So that leaflet will show you. So when you are doing the management, you explain that constant inflammation where rib joint, the bone is middle of your chest, breastbone or top chest pain, especially when moving, breathing. Check if you have moving your upper body, lying down, breathing deeply. So if you think it's important chest pain, check out. Spread to your arms. So these are the things you need to. Treatment for costochondritis is get better on its own over time. So reassurance, it can last for a few weeks to several months. Painkiller with inflammation like ibuprofen may be recommended with the help. If you have very bad pain, does not get better over time, you may be offered steroid injection, which I mentioned, to help reduce inflammation or local anesthetic. So causes of costochondritis not always known what causes. It may be caused by injury to your chest, repetitive upper body movement like lifting, cuffing, or lot. So sometimes it may cause by problem with the joint in the back so how would you say, if it is affecting your life, we can consider another treatment, and that is steroid, which I mentioned. And in terms of sick note in UK, what's the way that how the GP is the main area where you get the sick note, but yourself, you do not offer sick note. If the patient asks, you give them, try these things, you can get the attendance letter. You get the attendance letter. There are a few, you will say that a lot of patients will come and will say that just give me sick note and something like that. So you would go according to the treatment plan. So it's like something which can be treated with the ibuprofen. Yeah. And where the patient is not acutely sick, news are okay, patient is not having fever or something like that, but the pain could be quite a lot, but you try something and follow up with him or her. And in future, if the patient is very sick or something like that, anything else going on, then you can, but there is nothing very serious, then you would say you can get attendance letter, but we recommend you to try these things. Don't go for exercise at the moment because it is involved. Take some time, relax yourself, and this is what. But they won't bring up that, could you give me sick note? You would say that, yes, I can give you the attendance letter, you came here, but there is no specific sick note for 2 week or 3 week for this patient. Yeah. So,
Okay.
yeah.
Okay, I would just like to add a couple of things. Everything is said, everything is covered in great detail. Yeah, one thing, like Dr. Ramesh mentioned, that if the profession was checked, perhaps this person could be a gym instructor. So in that case, when the livelihood depends on that, then it becomes a different matter. Rather than attendance letter, then you would write a sick note as well. You could write a letter to their employer also, just to support them that they're undergoing this.
Yeah, if it affects someone's life, 100%.
Livelihood. That's another thing.
Because they do have.
In another word of caution, that sometimes when you offer NSAIDs, many of the patients, especially the Caucasians, they get a bleed or they get a very strong heartburn. So if that happens, oh, doc, it doesn't agree with me, or it messes with my stomach, then you can offer that, okay, we will give you some stomach protective medication along with that. And if they even cannot take that, then you have to be very careful and give them a paracetamol and the next step in the letter, because steroids also, like NSAIDs, can make the same thing. So that's about all. Yeah.
Yes,
Psychosocial always helps. If you could, this could go another way. And like the patient said, that this concern of there was not met. If the profession was different, then the management would go some other place.
Yes,
Yeah.
100%. Even if someone's social life is affecting, the GP
that's
can
true.
speak with the giving a letter or something like that, sick note. Yes, 100%.
Yeah. I saw Dr. Maria raised a hand, so
Yes, Maria.
she's a candidate for Lollipop. So please, yeah.
Lollipop, does she want to do consultation?
No, at least some comment,
Okay.
anything. Consultation would be the best. Yes, Dr. Maria, go ahead.
Sure.